A lot of you have heard me mention before in a lot of previous audios about how when some people exhibit certain serious permanent behaviors that they need to go to therapy. And it's no joke. And I think the worst thing that the federal government could have done years ago was to shut down the state institutions. I do understand a lot of them during that time were doing inhumane things, but what they could have done is they could have just went ahead and just re-regulated them, shut them down temporarily, and reopened them with some capable staff and press criminal charges against those who violated. But see, that didn't happen. The majority of the state institutions that you see for, mental health are usually the majority of them located in the South. The state that I'm in, Virginia, of course, is one of the original 13 colonies, so that's considered a southern state, and they have a state institution here. My birth state, in the state of Georgia, also has one as well. As far as all the states that I've lived in 6 of them. And I believe only 3 have institutions for mental health and the other ones don't. And I know there are a lot of you that are against the institutional process because of what happened in the past, but we're living in a new day and age now. And I truly believe that there are some people that simply cannot go unsupervised throughout their life, and they have to have extensive psychological therapy. And what's happening, I can't talk. What's happening is people are being declared as mentally incompetent in the court system, and they're being placed in penal institutions. And a lot of these penal institutions, first of all, they're not originally designed to treat people with psychological illnesses. That's one problem. They're designed as a system of punishment and rehabilitation. Number 2, the problem is that a lot of these institutions, the ones who do offer psychological help, is too overcrowded to the point where the professionals, the mental health professionals, cannot adequately diagnose or treat these illnesses within a reasonable amount of time due to an excessive caseload. Case in point, when I was doing graduate school in Illinois, I had to take a course in regards to trying to structure sessions. I forgot the exact name of the course, but basically it was how to organize the process of conducting sessions. And there was some textbook information in there, but a little did I know that the professor that was teaching the class was actually a psychologist in the Cook County health system, Cook County prison system, which was a system that I was seeking to go into. I was looking at going into prison psychology. But he turned me off immediately from that because he announced one day in class that he was with the system for so many years and had to leave because he felt that his work was ineffective, because within an 8 to 10 hour shift he was required to see 40 to 50 inmates that were classified as mentally incompetent. There is no conceivable way in this universe that one person can adequately treat and conduct a program at all of anyone, whether it's acute or chronic. 40 people in 8 to 10 hours. That's literally like one person every 15 minutes and that's without a break. One person every 10 to 15 minutes without a break. There's no way that can be done adequately. It's a waste of resources by the government. It's a waste of time. And the few prison systems that they do have, unfortunately, they're understaffed with people who have, psychological background that could treat the prisoners. Not to mention the environment itself is pressure enough. These people are under a lot. So, putting people that are declared mentally competent into the prison system, I'm quite sure the effectiveness rate is very low in the system because of lack of available resources. As I stated before, some of these people have conditions that require constant supervision in order for them to be treated properly. And the prison system simply does not have it. It doesn't. So, I pray that, sometime in my lifetime that the government actually allocates enough money and back into the mental health system, where they can have, some sort of permanent facilities in every single state, all 52 states, to have some kind of state facility for everyone to go to that's humane, uses current and groundbreaking research, qualified professionals, and is no way reflective of the old treatments that occurred. And we're talking about over 100 years ago, some of the things that people did. I think one of the last state institutions that got into trouble because of that was like maybe 50, 60 years ago. So a lot has changed in the area of mental health since then, and I truly believe that will happen, because really what it is it's a pattern. The person declared mentally incompetent, and if the crime is not severe enough to require a death sentence or anything like that, then it's just a matter of time before they're put back out into the street. They may be in the custody of a person, but whoever that person is, they have to try to organize ongoing psychological help for that person. And unless they have some sort of grant or some sort of organization providing the funds, more than likely that person doesn't have the money to keep paying for three and four sessions a week. They don't have the money for it. And then in addition to that, when they're not in session, they still might require constant supervision, and the person who they're in the custody of might not be able to do that because they're probably still actively working or have outside activities. So it's a huge undertaking. And like I said, I recommended it be done. I pray that it be done, and I'm not doing it to be cruel or anything like that. It's just that we hear too much in the news about situations where people who are mentally unstable that have been recycled through the system, in this jail, out the jail, go home, commit another crime, go back to court, declare mentally incompetent, go to jail, do another bid, go back out, commit another, and it just goes on and on and on until they do something to the point where somebody is harmed or they wind up dead. It's just, it's a horrible cycle for these people. So, I really think that it needs to be done, and that'll be, less overcrowding in the prison systems if it's done that way, and also to provide jobs to people in mental health fields that are funded by the government, secure positions, and it would just help people. I think they should be not reopened, but opened again, new age style, so to speak. So tell me what you think in the comments about that, because every single day we hear something about someone who is unstable, who has just been in and out of this treatment and in and out of that treatment, in and out of that facility, and they've had ongoing permanent problems for years. And the bottom line is they just need extensive therapy that just cannot be given to them being in the outside world. They can't interact with people. And tell me what you think about that. I think it would help the crime rate quite a bit. It would help homelessness quite a bit. I'm not trying to lock people away, not at all. But people have to understand that there are some mental illnesses that are very severe. and that require aggressive form of therapy. And not aggressive where we're talking about physically harming anybody at all. I'm talking about an aggressive treatment regimen, aggressive in a good way, that requires constant and ongoing attention to these people and people who are specialized in those fields. So tell me what you think about that. I think that's an issue that needs to be brought up to our government. They need to take that into consideration. And with that, I say good night to you.